you get this and you're like, well, I am suspecting that this patient has Hashimoto's thyroiditis. When the patient comes, are the patient going to complain of pain in the neck? No pain, okay? Pain is very unique to one specific condition with the thyroid, okay? So you're not going to have pain. It's going to be painless, right? It's going to be painless. If you look at the patient's thyroid gland, is it going to be enlarged? But I'm telling you, you're destroying the thyroid gland. Why would it become big if you destroy it? Should you have a goiter with Hashimoto's thyroiditis? If you're stimulating the thyroid gland like in Graves' disease, it makes sense because you stimulate the thyroid gland, you're growing it, right? But if you're going and destroying it and punching it around all over the place and poking it and stabbing it and all these things, should you have a goiter? Why would you have a goiter if you're having destruction of the gland? Does it make any sense? Inflammation, very good, because whenever you have inflammatory lymphocytic cells going and infiltrating into your thyroid gland, and then it's causing inflammation as well as forming all these germinal centers, right? A lot of inflammatory cells coming into your thyroid gland, right, is going to cause a lot of cell deposition, right? And it's going to cause a lot of inflammation, which means it can cause a goiter first, right? Initially, it will cause a goiter, right? And therefore, you can have an enlargement of your thyroid gland. So expect that despite it being a destructive phenomenon, right? Okay, so you're going to have a goiter in these patients with Hashimoto's thyroiditis.